Hi, I'm Maya Berenson, Doctor of Audiology and founder of Palm Beach Hearing Associates. And today I'm going to talk to you about, does Medicare cover the cost of hearing aids? Medicare does cover the cost of a hearing exam once a year or more if medically necessary. However, hearing aids are not viewed as a medical necessity. And for this reason, Medicare does not cover the cost of hearing aids. We as healthcare professionals understand just how critical hearing loss can be and can lead to social isolation, depression, memory loss that's correlated with dementia, and not to forget to mention a safety hazard. Treatment of hearing loss is critical once you have been diagnosed, but since Medicare does not cover the cost of hearing aids, what are some of our options? The first, check your secondary insurance. This year, more and more secondary insurance plans recognize just how serious not treating hearing loss can be and are providing some financial assistance. I want to take a few minutes to review just how this works. Your secondary insurance, whether it be Blue Cross Blue Shield, United Healthcare, Aetna, Cigna, Humana, or AARP, just to name a few, have recently partnered with third-party hearing aid vendors. These hearing aid vendors have significant buying power, and they pass the savings on to you, the consumer. I, the audiologist, will ensure that the correct hearing aid is ordered, that it fits your ears perfectly, and that it sounds great. Currently, there are 5 third-party groups that have relationships with specific secondary insurance companies. To give you an example of how this works, let's talk about Florida Blue. Florida Blue recently partnered with True Hearing. True Hearing is a third-party vendor across the United States that will connect you with a local provider in your area. The local provider will order the devices for you from True Hearing, and you get to benefit from 2 things. One being significantly lower prices, nearly a 30% savings, and 2, potentially an additional insurance benefit from your secondary plan. How do you know if you qualify? You can call your secondary insurance to see if you have a hearing aid benefit. 2, you can call your audiologist to see if they're network with your secondary plan. Most audiologists are trained to know the local plans and if there's benefit for hearing aids within that plan for you. Just to give you an example, I work with a billing company, and in a matter of minutes, we typically know what plans cover hearing aids. When you call the insurance companies, you want to be specific about 2 things. 1, is there in and out of network benefit? And 2, is it through a specific group? Once you have this information, you also need to make sure that your audiologist works with that specific third-party group. Most important takeaways from today's video is take the time to verify your insurance. The worst case scenario is that you don't have coverage and you're back to where you started. However, you might be pleasantly surprised and you might start your journey to better hearing sooner. Thanks for watching my video. Please share with me some topics of interest. Till next time, bye.